think people sometimes struggle with the decision as to whether or not they should seek mental health services or whether they don't need mental health services.
I think mental health and physical health are equally important to each other. I think you cannot treat one without treating the other. They have such an integral relationship with each other that you have to focus on both of them in order to treat like the whole person. The most common conditions we treat are depression, anxiety, bipolar disorder, personality disorders, schizophrenia, anything from post-traumatic stress disorder to childhood trauma and abuse, substance abuse disorders. We treat a wide range of conditions.
I generally think if you've got symptoms that persist for a long period of time, or you've tried some of those other things and those don't work, then it's not going to hurt to at least go in for an evaluation. Sometimes we have people that just come in one time and we find out that they're just going through something difficult, but they are doing everything that they should be doing, and we don't necessarily recommend services for them, but it doesn't hurt to at least go and find out, especially if your symptoms are impairing one or more areas of your life, like work, family, school, or your profession. Then it doesn't hurt to at least go and get an evaluation to find out.
To know if you need inpatient or outpatient services, the hallmark is if you feel like you're going to harm yourself, you absolutely need inpatient services. If you're feeling sad, anxious, that's when you reach out for outpatient services.
For outpatient therapy, people come in for assessments, sometimes they come in for testing. We provide outpatient mental health services, so like weekly counseling usually, or every other week.
So we do, generally speaking, an intake on someone, which would be a new client, and our job at the intake is to try to get a general sense of what's going on, what brought them to us, what kinds of issues or concerns or worries they have, and then with the client, develop a treatment plan in terms of what our goals are and how we want to get there.
My role as the inpatient provider is I'm the lead therapist, so I manage all the clinical aspect of the social work team. We have a great social work team.
I evaluate whether they have a diagnosis of depression, bipolar disorder, whether they're here for a psychotic disorder. I prescribe medications for them.
In general, our society has done a better job of talking openly about mental health. You do see little ads on TV from actors and actresses talking about their own mental health issues or the importance of mental health.
I encourage people to talk openly about the benefits of mental health because I think it's important to give life to your story. I also think it's important to work towards ending the stigma that is attached to mental illness, and that there is help for you and that your symptoms can be relieved.